This video aims to give you more information about radiotherapy for head and neck cancer at the Northern Radiotherapy Network. Whether you are coming for radiotherapy in Middlesbrough, Carlisle or Newcastle, the treatment you receive will be standardised across our network. It is just the location and the setting that will be different. The information in the video covers what is involved in the treatment, including aims and side effects, as well as the benefits and risks of any alternative treatments, including no treatment. It will help you decide whether you wish to go ahead with the treatment, and you will have an opportunity to discuss any questions or concerns with your clinician.
The network's very familiar with treating patients with head and neck cancer, and we have very established multidisciplinary teams who are very expertise in treating this sort of cancer. So you should be well looked after, and you'll be going through a very specific and well rehearsed and organised pathway of care.
What is radiotherapy? Radiotherapy is the treatment of cancer using high-energy X-rays. The aim of radiotherapy for head and neck cancer is to try and cure the cancer or control it for many years. Radiotherapy for head and neck cancer can be delivered in various ways. Usually, it is given from outside the body as external beam radiotherapy using a linear accelerator machine. Intensity modulated radiotherapy is the most common type of external beam radiotherapy. It uses multiple beams of radiation that comes from different directions and shapes the beams to match the shape of the cancer. Your consultant will detail and explain the options to you. The different techniques treat the cancer while protecting healthy tissue and reducing side effects.
Radiotherapy is just as effective as surgical treatment, and in some parts of our sort of subsites in head and neck cancer, it's the more preferred option. And certainly when you've come to our centre to get radiotherapy treatment, that decision will be made collectively in our multidisciplinary team meetings. So radiotherapy treatment is really energy that's given from an external machine, and it gets targeted to areas in the sort of head and neck region. And how we use the machines now is we want to target the areas which we want to treat, which is the area of cancer, and also the areas where there may be cancerous cells, or areas which we think are high risk of having problems. And we also want to minimise any sort of energy or radiotherapy targeted at the areas which are your normal healthy tissue, because they're the sort of tissues we want to kind of preserve and sort of spare to make sure that you've got good quality of life when you come through your cancer treatment.
Planning a course of radiotherapy treatment is very important because it ensures each treatment is given accurately. Your treatment is planned by a team of radiographers and dosimetrists under the supervision of your consultant. During your planning scan, you will need to lie in the same position you will be in for your radiotherapy. To ensure you are always in the correct position for every treatment session, you will be required to visit the mould room as part of the planning. The mould room is where you will be fitted with a plastic mesh mask. This is made individually for you. The technician who makes the mask will explain everything to you. You can see and breathe normally while wearing it. It fits tightly, but should not be uncomfortable, and you will get used to it very quickly.
What will happen is when we pop the front part of the mask on you, you will feel it warm, wet and pressure applied. As it starts to set, it already starts to set in about a minute, so you'll start to feel it get a little bit tighter just as it's setting. It's not going to hurt you, it's not going to stop you breathing, it's not going to do anything at all like that. You'll be able to breathe unrestricted at all times. What we do when we're creating the mask for you is that we will put your identification on that, so we know that is your mask. This is then located in our stores where we have it, and then it is then taken to the treatment machine when you're starting to commence your treatment, so that the radiographers know. They will go, we are getting you in, we will collect your mask and bring it in, so you don't need to take it home. It doesn't go anywhere else, it stays stored in the hospital.
The planning scan involves the use of a CT scanner to identify where we need to treat. A CT scanner is a donut-shaped X-ray machine, which is used to take pictures that the team use to plan your treatment accurately and to target the area that needs to be treated. This procedure takes about 10 minutes and is completely painless. The therapeutic radiographers will have checked the referral from your doctor, and they will ask you to confirm your consent. They will also explain what clothing needs to be removed and help you achieve a comfortable position which you will repeat each time you attend for treatment.
You want to just take a seat?
Yeah.
Keeping still for the scan is very important, so if you are not comfortable, please tell the radiographer and they will try and make some adjustments.
I'll move this up for you a little bit. Okay, we're just going to start raising the bed into the position.
The planning scan's very straightforward. Obviously it'll be the first time that you're probably wearing your mask, and they will just fit you in the position, and there'll be some reference marks on your mask. And the scan itself, it takes less than 10 minutes. You don't feel anything. It's just high energy x-rays, so the body can't detect it. The planning scan is very important because we need to be able to define exactly where your tumour is so that we can make sure that we give the full dose to that area while also minimising dose to the sensitive structures around the area, commonly including the spinal cord and your parotid glands. The scan just involves you wearing the mask that's being designed for you. You don't feel anything while you're having the scan, and the machine doesn't touch you.
You will have image-guided radiation therapy. This is a method of radiotherapy that incorporates imaging techniques during each treatment session. Your clinician will talk you through any other treatment planning that is relevant to you. A team of radiographers will treat you. You will be asked to lie on the treatment couch, and the radiographers will use the mask to position you in the right place under the treatment machine. Treatment times are usually very quick. You will be in and out of the room in about 10 to 15 minutes. Most of this time is preparing you, like getting undressed and positioning you. The treatment itself only takes a few minutes. You will feel no pain or discomfort. We ask you to breathe normally and to keep as still and relaxed as possible. Most machines make a noise. This lets you know the treatment is taking place. You will be alone during your treatment, but the radiographers will be able to watch you and listen via an intercom and closed-circuit camera system.
The treatment itself is very straightforward, and it's the same every day. So you'll just be lying down wearing your treatment mask, and they'll use the marks that are on your mask to get you lined up into the right position. Once they've got you in the right position, there'll be some small movements on the couch while we're targeting the centre of the area for the treatment. The radiographers will then leave the room, and then it's 2 minutes maximum to acquire a scan. They then use that scan to compare to your planning scan to make any fine adjustments so that we're as accurate as we can be up to the millimetre, and then the treatment's delivered, and it all takes about 15 to 20 minutes. There's an intercom system, and there's also CCTV cameras in the room, so we're watching you at all times and listening. And if you are concerned, we can actually talk you through the process from outside the room using the intercom. You're lying flat on the treatment couch on your back. The mask is what we call a 5-point mask, so it covers from the top of your head across your shoulders, and obviously there are some popping sounds as they obviously fix you to the tabletop, and you'll be wearing the mask at most 20 minutes each day.
Side effects of radiotherapy treatment for head and neck cancer usually begin 2 weeks into your treatment. They continue to develop for up to 2 weeks after treatment ends, before slowly improving. Your radiotherapy team will explain what to expect and how to manage any side effects. Please view our video on side effects for head and neck cancer for more detailed information.
All our staff are very friendly, approachable. We anticipate, and also we entirely appreciate that these are very difficult times during people's lives for you and your family. We'll have contact numbers with our clinical nurse specialists where you can leave a message anytime, and we'll get back to you, and we'll hopefully be able to help you with any queries that you have.
Following your treatment, your health professional will talk with you about what happens next. You will continue to have tests for monitoring and ongoing follow-up with your team. We are aware that some patients may require extra support and help whilst visiting the department. If this is the case, please let us know either in advance or on the day of your visit, and we will assist with your needs in any way we can. If you are running late for your appointment, just let the department know, and please don't worry. We try our best to keep to appointment times, but delays do happen sometimes. If we are running late, we will let you know. Please visit the Northern Radiotherapy Network website if you have any questions or queries.